Depression is an illness that has been around for centuries and needs to be talked about. It causes people to lose interest in activities and hobbies, reduces energy, feeling fatigued, insomnia, and in some cases, suicidal thoughts. Yet, it is still looked down upon. Hi, my name is Jaden Gillespie, and today I'm going to be informing you why depression needs to be taken seriously. Depression affects over 264 million people of all ages every year. The common ages ranging from 15 to 44, while that age range does not mean anything because it can affect ages younger and older. See, the thing is with depression, it has no limit and can affect anyone. People fail to realize how depression can affect both the brain and the body. Depression can be the result of so many things, some being postpartum, PTSD, drug and alcohol use, personal issues, medical issues, as well as having so many underlying issues. Many people are afraid of coming forward with troubles of depression out of fear of being put down and looked down upon, and that needs to change. Depression needs to be taken seriously, and to be able to take depression seriously, the understanding of how it occurs, how it affects people, along with the risks, and how it can be helped and potentially save a life needs to be informed. In the United States alone, depression affects 18 million adults in any given year, with the ages ranging from 15 to 44, as stated before. And with those numbers, roughly 41,000 people commit suicide every year due to depression. As stated by Beyond Blue circa 2020, while we don't know exactly what causes depression, a number of things are often linked to the development. Depression usually results from a combination of recent events and other longer term or personal factors rather than one's immediate issue or event. There is no known cause of depression, yet there are so many aspects of this mental illness that people who do not experience it fail to notice. As stated before, family history, one's personality, including low self esteem, high stress levels, anxiety, self critical, and negative behavior, serious medical issues, and drug and alcohol usage are a large part of this. Depression can be the effect of so many things, which is why people need to understand it and take it seriously, because there's nothing more important than one's mental health and understanding others' mental health. If someone were to come up to you and say they needed to just talk to somebody and let everything out and just allow themselves to feel emotions, would you say no and turn away their problems? No, you would sit there and listen to them and show them the compassion that they need to be shown and show them the support as well. See, depression is a fight with one's brain that no one may be able to truly understand. However, what we can do is to listen and try to understand rather than pushing it aside, and help and support should be welcomed always. As stated by Bruick 2019, depression can commonly be identified as feeling depressed, fatigued, worthless, or guilty. People experiencing these episodes often also do not get the right amount of sleep, struggle to concentrate, and may think about death often. Depression is something that goes on deep within one's mind and emotions. Some people may feel as though they have to keep everything pent up because they are a burden when it comes to talking about their feelings. Depression needs to be something that is not joked about because it is becoming too normalized. People need to talk about what's going on and feel the support system that they have rather than feeling lonely, which in most cases is sadly the case. There are many resources that people who are experiencing mild to severe depression that people can go to and are covered by healthcare providers. Those including behavioral activation, cognitive behavioral therapy, interpersonal psychotherapy, or antidepressant medications such as selective serotonin reuptake inhibitors and tricyclic antidepressants. That is from WHO 2017. There are also resources for someone who is in need of immediate help or assistance as well. The suicide hotline, as well as SAMHSA, which is Substance Abuse and Mental Health Service Administration hotline, both of which run 24 hours a day, 365 days a year. Depression is such an important topic to cover, not only am I personally connected to, but millions of people in the world and the United States are connected to. Many people are afraid of coming forward with troubles of depression out of fear of being put down and looked down upon. And that needs to change. Depression needs to be taken seriously. We need to learn about depression. We need to give the resources that are needed. Depression should not be overlooked or joked about, rather, it should be taken seriously, no matter what or by who. It is something that needs to be researched, understood, and treated. If you or a loved one are experiencing any, and I mean any of these symptoms, please seek immediate help or attention because you are not alone and you are loved. With that, thank you so much for watching, and I hope you learned more about depression today. And again, if you are experiencing any of this, please search immediate help. Please get the help that you need. You're not alone. It is not wrong to have a mental illness. There's nothing wrong with that, and you should never feel ashamed. And with that, I will leave you with this Bible verse, Isaiah 40:31. But those who hope in the Lord will renew their strength. They will soar on wings like eagles. They will run and not grow weary. They will walk and not be faint. Thank you so much for watching, and God bless.